Many people have heard, probably because of articles in Cranes and the Chicago Tribune today, that there has been an acquisition of the Neurologic and Orthopedic Hospital of Chicago by NorthShore Healthcare Systems. And that is true. What does this mean? Well, basically, the CINN Medical Group is a wholly owned subsidiary of the Neurologic and Orthopedic Hospital of Chicago. So it means that the CINN doctors who now practice at the Neurologic and Orthopedic Hospital will move that practice to one of the North Shore hospitals, initially probably Skokie Hospital and then possibly Glenbrook Hospital. It depends on a lot having to do with future construction and needs of the patients and needs of the doctors and space needs and technology needs and so on and so on. But it doesn't mean that the CINN Medical Group will cease to exist or that it will exist in any different way than it currently does. The group was founded in 1986 with certain guiding principles. One of the principles was the need to subspecialize within the field of neurosurgery, because we recognize that a person doing spine operations might not have the same mindset or skill set as a person doing vascular operations, and that person might be different again from the person who does brain tumor operations, who might be different from the person who does child pediatric neurosurgery. So we recognized that there were a number of different subspecialties within the field of neurosurgery, and that these were becoming more and more sophisticated, and that the patients could best be served by having one person do this and one this and one this, and then of course having some general neurosurgeons who do a little of everything. And that has served us very well over the years. Another of the reasons for forming the group was to capitalize on the fact that there were huge changes in the technology of medicine, MR scanning and PET scanning and CT scanning and endovascular treatments and spinal instrumentation, etc., etc., etc. And to avail ourselves to that technology was very, very important. So we needed an institution that was ready to invest in that technology for the doctors and, of course, for the patients. We also recognized that if we were going to attract the best doctors from around the country, and we did, we needed to offer them some educational opportunities to do research, to teach, to publish, to present. And again, that's something that we have been very active in the CINN Medical Group. And finally, we looked to have a relationship with administration of the hospital or hospitals, which was very mutually supportive. And as you may or may not know, a lot of hospitals' administration is kind of at odds with doctors. We don't think that that's the best environment to practice. So with this North Shore acquisition, we have maintained all of our original founding principles: the subspecialization, the exploitation of technology, the clinical and basic research, and the excellent, supportive, mutually beneficial relationship between physicians on the one hand and administration on the other. So we are very, very excited about this change. All of our satellites at Elmhurst and in Harvey and throughout the Chicago area will remain exactly the same. The patient care will remain exactly the same. That's what we pride ourselves in, and that's what we'll continue to pride ourselves in. But the location at the CINN flagship, the Neurologic and Orthopedic Hospital of Chicago, will change locations. So we kind of pick everything up from here and move it over here, including, in most cases, the staff, the doctors, the therapists, the technicians, the family.